broad support for religious discrimination so far within your party, but some in the coalition have called it weak. There's a rump of moderates that are still deeply concerned. Is it in trouble?
Well, these are challenging issues, Pete, just in terms of making sure that you get the laws that are being proposed right, that you deal with some tricky and difficult matters associated with them, that in principle what is being sought is something that has strong support across all elements of our party room in government, and that is to put in place an anti-discrimination law for people of faith on the basis of religion, just the same as we have anti-discrimination laws based on people's gender, their sexuality, their age, their disability status, all of those different factors, that you shouldn't be discriminated against when you're going to rent a house or when you're looking for a job on the basis of your faith. And they're pretty simple principles. But then when you get into some of the details as to how other elements of that are applied, there are some points of contention, and they, of course, are there to be worked through, and that's precisely what's been happening.
OK, but if the government can't pass this legislation, has it lost a mandate to govern, considering it was a promise?
No, Pete, no, that's certainly not the case. The words I think that Scott Morrison repeated most at the last election were about the need for a strong economy. And that is writ large on the fact that we've got unemployment at 4.2%, 13-year low, that we've got 1.7 million more Australians in jobs, that we have managed to overhaul the income tax system with reforms that will wipe out, when the final stage occurs and applies, will wipe out an entire tax bracket, and even at present are putting $1.5 billion a month back into the pockets of hard-working Australians. These are the sorts of things that are the mandate and the delivery of the government against that mandate for a stronger economy. Of course, we made other commitments and we worked through those, such as the religious discrimination reforms. OK,
you're turning the screws on Labor this morning. That's been the case for a couple of weeks now. But you're laying out extra costs that their policies would cost. What are those totals, which equal about $81 billion? What does that say to you?
Well, Pete, that's right. We've done a bit of an analysis just across 6 different areas of policies and things the Labor Party have called for during the course of the COVID-19 pandemic. And just across those 6 areas, the Labor Party under Anthony Albanese would have spent an additional $81 billion on top of what has already been record spending, and record spending that has been proven to work in terms of jobs outcomes, to work in terms of keeping Australians safe and secure compared to the rest of the world. And what it demonstrates is just how profligate and wasteful the Labor Party remains, their inability to say no when you should say no, the wacky ideas such as the $300 payment they called to be made for Australians to get vaccinated, when of course 94% of Australians have turned out to get double dose vaccinated without the need for any such bribe or payment that just would have been completely wasteful. And so it's a big reminder coming into the election when there's a choice to be framed, that the coalition will do what is necessary and has spent what has been necessary to get through COVID, but we've also had the restraint and the ability to say no where required, whereas the Labor Party always saw the need for more spending, some $81 billion at least extra that would have been piled onto the national debt had they got their way.
Isn't it a bit rich, though, to be talking about their costs when debt is the highest it's ever been under your government?
It is still, of course, about a framing and a choice at an election campaign. Yes, we've had to respond to a global pandemic in ways that we would never have envisaged at the time of the last election or before the pandemic hit, in terms of support for the health system, support for the economy, all of which have been proven to work. Now, we haven't got absolutely everything right, and of course, if you could go back and change things again, with the benefit of hindsight, you would, and we get plenty of commentary about that from the Labor Party.
Like the slow vaccine and rapid test rollout?
And they're all, they're all great experts.
So what did that cost the economy?
In hindsight, they're all great experts in hindsight. But the reality is, we've managed to get 94% of Australians vaccinated. We've actually managed to maintain some of the highest testing rates in the world quite consistently, with free testing available to all those who need it, whilst Labor, of course, want to create an additional cost in terms of spraying tests even further afield, not just for those who are close contacts, those who are symptomatic, those in essential, critical and vulnerable sectors of the economy, where we're making sure all of that is available, Again, they call for yet more spending to happen, and that spending ultimately adds to the debt, adds to the challenges in terms of bringing the deficit under control. And so choice remains one that we will frame ahead of that election.
One of those sectors, as you know, aged care in deep, deep trouble. 533 deaths in aged care this year, yet the minister who's already been demoted, still there. I mean, no way would that happen in the private sector. As Labor asked yesterday, why is Richard Colbeck still there?
Well, Richard Colbeck has been working hard alongside Greg Hunt in terms of engaging with the aged care sector. Tens and tens of millions of pieces of protective equipment, 80,000 plus different shifts as part of the surge workforce capacity that we've helped to put in place to support the aged care sector. The fact is that 100% of aged care homes have been visited to provide offers for a booster dose. It is hugely challenging right around the world, but in Australia, the mortality rates we're managing to keep and fatality rates from COVID-19 lower than the global averages. But when you have something spreading like Omicron, it is going to spread across all parts of the country, and that includes, tragically, at some instances, into aged care sectors. But the type of responses that have been put in place have been focused on providing the kit, the equipment, the vaccines, and helping with the very challenging issues of staff disruptions that occur because of people having to stand down.
Simon Birmingham, thanks for your time as always. We'll talk to you soon.